Welcome back to our third episode of Therapy Thursdays. We are Fyzical. We're coming to you from Louisiana Living, and we are talking about different conditions or medical diagnoses that might hold you down, and we are going to teach you some things, teach you some exercises that you can do, because we want you to love your life. I'm Angela Yarborough, and this is Dr. Jerry.
Thank you. I am Jerry Yarborough, Doctor of Physical Therapy, and we are the owners of Physical Therapy and Balance Centers of Ruston, Jonesboro, and El Dorado. And as Angela explained, we are here coming every Thursday as a part of Louisiana Living to explain different medical diagnoses or conditions that are affecting your quality of life. And we're going to be talking about those different diagnoses and conditions and how therapy can help you overcome those conditions or the impairments from those conditions. And one of our mottos here is that we do what we do to help you love your life, and that is our passion. We want to help you be able to get back to doing the things that you love. So what we've been talking about last week, we actually started a series of 3 shows about back pain. There are many, many different causes of back pain, but we're talking about the 3 most common causes. And if you remember from last week, we talked about the stenosis or the degeneration that can cause back pain, or sciatica, or pain down your leg is what sciatica is. And today we're going to be talking about low back pain and sciatica, which is caused from a disc herniation or bulge. So come back after for the next segment, in which we'll be discussing that further, and then we'll even go over your takeaway for the day, which is the 3 most common exercises that you can start doing immediately to help you overcome this back pain. Now, remember, we are the back pain and balance experts of North Louisiana and South Arkansas, and we would love to help you if you ever need us. Remember, there's no prescriptions required, so if you're having back pain, don't get lost going from place to place. Just call your physical therapist and make an appointment, and we can see you. And yes, your insurance do cover your cost or your portion or whatever of the physical therapy. Again, just look us up on myarclemist.com or physicalruston.com. Here in Ruston, we're located at 1701 Commerce Street, and we would love to see you.
Welcome back to Therapy Thursdays on Louisiana Living. I'm Angela Yarborough. This is my husband, Dr. Jerry Yarborough, and we are talking about back pain today. Do you know that 80% of all Americans are at some point going to experience back pain? With that percentage being so high, we want to show you how you can prevent that or get better, because we want you to love your life. What do you think, Dr. Jerry?
That's right, sweetheart. Thank you for that introduction. And we are talking today about low back pain and sciatica. First, I'm going to give you a little overview of the anatomy of the spine, just so you got a little better understanding. So, the bones of our spine are called vertebrae. Up in our neck, the cervical region, we have 7 vertebrae. Then the thoracic, we have 12. Lumbar, low back region, we have 5. Then the sacrum, we got 5 more, and then the tailbone's 2 or 3. So when we're young, our bones start off real nice and smooth. But as we age, we have different trauma, different accidents, different wear and tear. Our bones become less smooth, more jagged. And the disc, as we age, I like to think of them as, when we're young, as a big fat marshmallow. And as we age, they become dried out and they shrink. And sometimes they get weak on that outer wall and they will bulge or herniate. And whenever it does, off of each segment on the spine, we have nerves that come out. Now remember, in the cervical region, those nerves come out and innervate the arms. Thoracic region, they stay around your rib cage. Lumbar region, they go in your lower back and down your legs. And that's how you can have sciatica pain, which is pain that shoots down your leg. So that disc will bulge, and it's kind of like this graphic here. It will show you that bulge, and it will compress that nerve. or pinch that nerve. You've all heard things like that. And that's the common cause, second most common cause of back pain. So if you are, in the age range of 40 or above, and you're having back pain whenever you sit or whenever you bend, twist, or cough, those are the golden signs of back pain from a disc herniation. So make sure you come back to this next segment. We're going to go over the 3 most common exercises to help you with back pain or sciatica caused from a herniated or bulged disc. Thank you. Welcome back to our last segment of Therapy Thursdays today. I am Dr. Jerry Yarborough, owner of Fyzical Therapy and Balance Centers. And today we've been talking about the second most common cause of back pain and sciatica, and that is from a herniated disc or a bulging disc. Actually, 80% of the population experience this. So remember, if you are having pain from sitting too long, bending over, coughing, sneezing, those are golden rule signs of back pain due to herniated disc or bulging disc. So this is my office manager, Jamie, and she's going to demonstrate the 3 most common exercises for a herniated disc for us. First, you're going to put your thumbs in your back like that, and you're going to arch your back like this. So this is an excellent exercise. Even if anytime you're doing any heavy lifting or anything, you always want to follow it with back extension. And what that does is that helps push that disc back into position. All right, so again, extend your back like that. And then Jamie's going to lay down here on her stomach and show us a couple of other exercises. Now, if you have an irritated disc, just laying flat is going to be extremely painful for you. So you'll want to start off with putting some pillows up under your hips, even 2 or 3 if needed, but you want to get to where you start laying down. As that becomes easier, you take those pillows out until you can lay flat like this. Once this isn't a problem, you're going to work up to being up on your elbows. So Jamie's going to get up on her elbows like that, keeping your pelvis down. Now your goal is to be able to stay in this position for about a minute. And you can do that for 10 times. And then the progression from this is going to be pushing all the way up onto your hands, keeping your pelvis down. And again, try to hold that for a minute and do it 10 times. All right, that's the 3 most common exercises for back pain due to a disc problem. Again, if these exercises don't give you relief, we are at Fyzical the balance and back pain experts of North Louisiana and South Arkansas. We would love to help you love your life again. So look us up on arklamis.com or physicalruston.com. Thank you, and we'll see you next week, in which we talk about the 3rd most common cause of back pain.
Visit us every Thursday for Therapy Thursday with Dr. Jerry Yarborough of Fyzical Therapy and Balance Centers of Jonesboro and Ruston. Every week, right here on Louisiana Living.